to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is on reducing falls and improving cognition with exercise, presented by Jessica Garrison, and sponsored by the Prince George's County government and the Department of Family Services. Good evening, everyone, and welcome to the Dementia Friends of America webinar series. I'm so glad you are joining us tonight to learn more about dementia awareness and how we can build a more supportive and informed community. My name is Caesar, and I am honored to be here on behalf of Dementia Friends of America and our local DFA Northern Prince George's County initiative. Tonight's session is part of our ongoing effort to increase understanding, reduce stigma, and provide meaningful resources to individuals, caregivers, and professionals impacted by dementia. Before we begin, I want to share an important opportunity with you all. In partnership with the Alzheimer's Foundation of America, we are offering free confidential memory screenings for adults who would like to better understand their cognitive health. These screenings are one-on-one, they are private, informational, and a caring first step, which does not mean it is a diagnosis. The screenings are available at 15 Crescent Road, Greenbelt, Maryland, starting Tuesday, February 10th from 9 a.m. to 2 p.m. And to schedule an appointment, you can call either me or Canella at the numbers below. And we want you to know that early detection and awareness matters, and we encourage you to take advantage of this free service or share it with someone that you may think would benefit from it. We also invite you to consider becoming a dementia friend through a short online training. You can learn how dementia affects daily life, how it can improve communication and support skills, and how it can help create a more inclusive and understanding community. It only takes a short time to complete, and you'll receive a certificate upon completion. And you can register at dfaamerica.org/become a dementia friend. And always know that small actions like this truly make a big difference. And we understand that dementia impacts not just individuals, but families and caregivers as well. That's why we offer free caregiver support groups, both in person at the Greenbelt Community Center and virtual via Zoom. These groups provide a welcoming space to connect, share experiences, and receive encouragement. The Memory Cafe has a pre-registration that is required before attending, and it is a stigma-free environment for individuals with early stage Alzheimer's disease, mild cognitive impairment, or other dementias, along with their caregivers and loved ones. We also host special virtual programs like See Me at the Smithsonian, offering engaging and interactive experiences. If you are feeling isolated or looking for connection, please don't hesitate to reach out. Remember that you are not alone. And for more information, you can contact Sharon or Natalie at the numbers provided below. And our webinars continue weekly at 7 p.m., covering important topics such as a deep dive into the 5 dementias and many more expert-led discussions. Just be sure to register for upcoming sessions and invite others who you may think would benefit from it as well. And also just some opening announcements and house rules just for tonight's presentation. I will ask that everyone refrain from asking any questions so as to not interrupt the presentation until the end of the presentation when I open the discussion up for questions. And you are welcome to always leave your questions in the chat at any time as well. Okay, so now let's begin tonight's presentation. Jessica, I will pass it on to you now.
Okay, thank you, Caesar. Good evening, everyone. My name is Jessica Garrison. I'm a master occupational therapist. I have my doctorate in healthcare administration, and I am a certified advanced cognitive specialist and dementia practitioner. And tonight I'm honored to be here, and I'm going to be presenting on reducing falls and improving cognition with exercise. I'm all about helping the community maintain their independence through wellness. I believe that wellness is the first step in our journey. So thank you for having me. So I want to go over 3 different topics this evening. We're just going to discuss some basic fall statistics. We're going to review exercises that can help you prevent falls, maintain your balance, and help with strength. And we're also going to explore the added benefit of exercise and how it helps to improve your overall cognitive function. So some really simple fall statistics. About 1 in 4 older adults report falling each year throughout the United States. That's roughly 27.5% of community dwelling adults over the age of 65 have reported at least one fall in the last year. And it's not just here, this is a global issue, with some reports saying 28 to 35% of community dwelling adults over 65 fall annually, and some studies even report up to 60% of adults fall annually. I will tell you firsthand, being a therapist is my primary role, and almost 2 decades in the industry, I would say about a quarter of the patients I see are from falls. And just to give you some background, I work in subacute rehab, I work in long-term care, and I work in outpatient. So I fall under all 3 of those umbrellas. So I see adults who live in the community and they've had a fall and they need to go to outpatient rehab. I see adults who were living in the community, unfortunately had a fall, which led to an injury, which may or may have not led to a surgery, but they can't go home right away. So they need to do subacute rehab for about 2 weeks before they go back home, and inpatient rehab. And then again, I experience long-term care. So I have adults who are living in a long-term care environment or with caregivers who fall and also need rehab. So when I tell you that, not to scare anyone, falls are very real, and they can, how do I say this? Sorry, they can affect your confidence, and they have a direct impact on your overall well-being. So a lot of falls, as I was saying, can lead to injury. Those are the patients that I generally see. About 10% of older adults report fall-related injuries, and that is about 170 injuries per 1,000 adults. So that's a lot of people getting injured when they do fall. Approximately 5 to 10% of community dwelling fallers do sustain serious injury, and falls are the leading cause of fatal and non-fatal injury among adults 65 and older. Again, as I said, that's about 25% of the population that I work with. So there's also the issue of recurrent falls. About half of the community dwelling fallers experience multiple falls. Approximately 25% of fallers restrict activity due to the fear of falling. And that's really important to understand. When you restrict your activity because you've fallen once and you're fear of falling again, that's going to limit your ability to participate socially, but also you're not doing as much as you normally do. So you're not moving your body as much. So then your muscles become weaker, so that when you do something, the chances of you falling again are even higher, because 1, that you're afraid, and 2, that you haven't been as mobile as you were previously. So now your muscles are weaker. I'm going to share a very personal story with you. My parents were recently, every year they go away to Vegas for vacation. They like the shows, they like the lights. It's the thing that they've done for the last 20 some years, the 2 of them. They're both in their 70s. I called to check on them and to see how they're doing. And my mom answered the phone and she said, "Jess, you won't believe it. I was in the casino, all the lights, the whistles, the bells went off. And I was like, oh, you won. She goes, no, I fell into the slot machine. I said, what? She's like, yeah, they don't like it when you mess with their slot machines. I said, well, you didn't mess with it, Mom. She was walking with my dad and her best friend and had her cane, because she walks with a cane, and she fell on top of the slot machine. All the whistles went off, security came out, realized that she fell. She was a little, hurt her hands from falling outward, which many of us do, but I think her ego was hurt a little bit more. Fast forward to the end of their trip, they came home, and me being the therapist that I am, I'm prying for more information. I said, well, what were you doing when you fell? She said, well, I've been getting dizzy lately. I said, well, you didn't tell me you were getting dizzy. She said, I have some pain. I have pain in my legs and a little bit of pain in my back. I said, well, when were you going to tell anybody that you have pain and that you were getting dizzy and now you fell? Well, I didn't want to tell you guys after I fell the first time. I said, what do you mean the first time, Mom? I found out that she had fallen 30 days prior. So that's 2 falls in 30 days. What's the first thing that I did? I told her, we're going to the doctor. Anybody who falls should definitely go to the doctor. Even if you don't sustain an injury that you see at first, it's really important to go to the doctor, or at least call your doctor and report that you that you have fallen. And you want to think about it too, like, why did I fall? My mom said she was getting dizzy, and she had some dizziness for over a month, and she had fallen before. She kept all this to herself. So the first thing we did do is get on the phone and make an appointment with her doctor. I'm going to be there with her. And I'm also, second thing I'm going to do is ask for physical therapy consult. Because the one thing that I know that I can do for her is to build up her strength and build up her confidence, because she has had 2 falls in the last 30 days. So it's a little personal story, but when I'm giving you these statistics about falls, I want to reinforce about how real this is. I've just experienced this within my own family. So there's some key takeaways when we're talking about falls. Falls are common and they are predictable. The rates increase as we age, especially being at the highest rate when you're over 85 and older. Many fall risk factors are modifiable. And what that means, just like I was saying with my mom, you can work on your strength, you can work on your balance. You have to talk to your doctor. Maybe it's a medication that you were on and you need a medical review of the different meds you're on. Maybe there's something in your home that is not the safest thing. Like, we like to throw the throw rugs around so that we don't ruin our carpet or the high traffic area. Those are fall hazards, especially when you start using a cane or a walker. So maybe you need a home safety assessment conducted. Maybe it's your vision, and maybe it's not as great as it used to. Maybe you need to have your vision checked, or even hearing, because your hearing could start to decline, and then all of a sudden you hear a sharp noise, you turn, you react, you lose your center of gravity, and you fall. So there's many different things that are modifiable, and there's many things that we can do to help prevent falls. Even non-injurious falls really can affect your independence, your confidence, and your overall mobility. Because again, the number one thing that people do when they fall is they start moving less because they're afraid they're going to fall again. But there is a solution. So exercise is the solution. The impact that exercise has on fall prevention is absolutely priceless. So we're going to talk about the physical component first before we go into the cognitive component, because exercise really has a dual function. So research over the years has consistently showed that multi-component exercise programs, and that's a program, when I say multi-component, that focuses on your balance, your strength, functional training, and coordination, they're most effective at reducing falls in the older adult community. So when we talk balance training, that should be the highest priority. And the reason it works is because it improves your postural control, your proprioception, which is the concept of where your joints are in space. So if I'm standing, like where my knees are below me, my ankles are below those. That's what proprioception means. And your reaction time, and key factors in preventing falls or working on your balance training. So different examples of this are like the single leg stance, the tandem stance, the heel to toe walking, weight shifting from side to side, and reactive balance training. Now, on this slide, you see I use the picture of a gentleman holding the back of the chair. It's really important to come into this with the idea that we're coming into exercise and strengthening our body at all different levels, right? So if you've fallen and your balance is a little off, as a therapist, I'm always going to start my patients off first by holding on to something. So if you're at home and you want to do that single leg stance, hold on to the back of your chair while you do one leg at a time. Stay on a one leg for 10 seconds, then switch legs, go on the other leg for 10 seconds, but maintain something that you can hold on to, whether it be your counter, something stable, your chair or your countertop. It's really important to be safe. And then as you progress, or if you're a higher level and you already belong to a gym, start finding a routine where you can really focus on your balance training. And then lower extremity strengthening. It's kind of like one of those things where, like, of course, you want to strengthen your legs, you want to strengthen your glutes and your calves, and you want to be able to support the weight of your body. But it works because it helps to improve your overall muscle power that you need for everyday tasks. Like something as simple as sit to stand, standing up from a chair, you know, or you can push up from a chair. Those right there are working your quads. So you really want to work on strengthening your lower body. You can do stair climbing. You can work on how you walk, your gait stability. And then it also helps you recover from trips or stumbles. So different examples of this type of exercise are sit to stands, step ups. If you notice in the picture, she's using a little stepper, but I always like to go back to things you can do in the home too. If you have like a set of stairs, and especially if there's a railing, because you want to be safe, hold on to that railing and practice stepping up and stepping down while you hold on to the railing so you maintain your balance. Same like if you have a front porch and there's a railing there, hold on to your railing and you can do your step ups that way until you build up to a higher level where you could do something like she's doing in the pictures. And then of course there's resistant bands, hip and knee strengthening, leg press and squats. Also, another safe way to do your sit to stands is that if you are going to do these at home, I recommend that whether it's you or somebody who you love and care about that you're exercising with and you're in the home, make sure you push the chair all the way flat up against a wall so that when you do go back and sit down, if that person does plop because their balance isn't great, the chair can't slide away from them. It goes right up against the wall. So, and then research over the years has demonstrated Tai Chi is one of the best single exercises to improve your balance and to improve your strength. Plus, it enhances your coordination and your movement, and it helps with your confidence and reduce falling. So if you are at that level where you can take a course in your community that offers Tai Chi, I know some places even do it seated or they do a seated yoga. It is an excellent exercise, and it can also be a goal for somebody. If you're starting off in your home or you need to strengthen your body and work on your balance, and say you do go to a rehab center, and I'll talk more about the one I work at a little bit later, but say you do go to a rehab center and you graduate, you can find a Tai Chi program because you want to maintain the skills that you're building while you're in therapy or while you're exercising at home. So this is a great goal to work towards. It just depends. Again, we all start exercising at all different levels. So multi-component exercise programs, again, are key to strength. That is working on your balance and your strength and your walking all together, or functional training like reaching, turning, stepping, aerobic training and strength training and balance, a whole combination. All these different things together will really help support you aging in the community and help you keep your strength. So why are multi-component exercise programs better for you? It's because they do improve your strength and your balance, and they will help reduce falls and help improve your risk of falling, again, like reduce that risk. But exercise also has a second wonderful added benefit. It improves your cognition. And if you think about it, as a whole, when you're exercising, your brain's exercising too at the same time. Whether you're counting because you're doing a set for 10, or you're standing on that one foot, holding onto the back of the chair and counting for 10 seconds, and then putting your foot down and raising the other foot and counting for another 10 seconds. And then you might want to go and write down what you did today so you can do it tomorrow. So while you're exercising, your brain is counting, your brain is doing something too. Or let's just say something, if you were bouncing a ball off a wall, a higher exercise program, and then catching it. So now you have your mind thinking of your reaction time, so you can catch that ball or you can react to the force that's coming at you. So whenever you're exercising, you're also working your brain. So exercise improves cognition through your brain structure changes. There's different little neurochemical changes occur throughout your brain's network. And these effects are strongest when exercise is regular and sustained. So that means when you're regularly exercising, let's say 3 times a week, and you're doing it for a while, you're at the same time you're exercising your brain and you're improving your brain function. So you might get a little rush like one time that you exercise and feel really good about yourself, but to sustain that, you've got to keep moving, you've got to keep exercising. So exercise and cognition. Exercise improves the blood flow and oxygen delivery to your brain. And it also helps with your glucose metabolism. So by having increased blood flow to your brain, you're waking up those neurons and having that extra oxygen delivery to your brain, you're making your brain healthy. And these all support your neural function and help protect against vascular cognitive decline. And I know I heard Caesar in the beginning say he was going to talk about the different dementias. Well, vascular dementia is a type of dementia. And this is just another support, another tool that you can have in place that will help prevent with a further decline if you're exercising as well. So exercise promotes new brain cell formation and synaptic plasticity, learning and memory. So, when they say synaptic plasticity, the brain is amazing. The brain has this ability to almost kind of heal itself and rebound and remember things. And when you exercise and you coordinate, you keep and you sustain an exercise program into your daily life, you're helping those brain cell formations occur and you're keeping that plasticity vibrant and alive. So you're helping for the healing to damaged areas to occur at the same time. Exercise improves your overall cognition, your executive function, your delayed recall, and it's been shown to help adults with mild cognitive impairments. I told you, shared a little bit about my mom earlier falling twice in 30 days, her getting dizzy. She told me that over the phone that she had gotten dizzy before she came home. When she came home, she didn't remember telling me that she was getting dizzy. So we have a lot to talk about at the doctor, and I really want to get her into an outpatient program so she can start exercising and she can get a routine, amongst other things that I would like the doctor to look in, because I know that it's going to help her cognitively as well, and it's going to help her from a social aspect as well, just getting out of the house, having somewhere to go, and getting involved in that physical activity and getting involved in the physical movement, helping rebuild her confidence as well. So exercise has been known to improve your executive function. That's your planning, your attention, your decision making. This topic has been well researched. So a whole umbrella review found that exercise significantly improves your memory and your executive function. And this has been studied across many different populations. So when people don't like to exercise, like, oh, I don't want to exercise, it's really got a dual purpose for what it can do for you. Again, we're thinking about the whole topic of fall prevention and exercising to improve your strength and your balance, but at the same time, you're improving your brain and you're improving your brain function, which is your executive function, your general cognition, and your memory. So exercise has also been known to reduce inflammation and stress. So if you have chronic inflammation or any kind of stress or deregulation in your body, these all contribute to a cognitive decline. Well, exercise is also, through many studies, have been shown to reduce these factors in the body, which would take away from impacting that cognitive aspect, you know? So you're improving your cognition, again, by now reducing your inflammation and the dysregulation that's going on throughout your body. So again, another benefit of exercise. So exercise improves the brain's efficiency. It promotes functional connectivity, motor cognitive integration, and that's and dual task performance. So when I say that, think about those simple tasks, like where sometimes they're not as simple, right? You are, say you are heating something up in the microwave and the phone rings, and then at the same time the dog wants to go outside. That's a multitask component, right? You're answering the phone, you're opening the door, and now the microwave went off, so you got to get that out. You know, now you've got to go back to the door to close the door to let the dogs out or in. So you're doing multiple functions at one time. Exercise will help make that process smooth. Exercise helps with your memory, your retention, to remember the different tasks that you were performing, and it helps, you know, remember the sequence of how to do certain things. So again, this all is just leading again to how exercise will improve your overall cognition. So the best approach to incorporate exercise and get all of its benefits is to be consistent. And you have to be consistent if you want to see the cognitive benefits of exercise. This would be, you want to do it 3 to 5 times per week, about 30 to 50 minutes per session. And you want to sustain it for 12 weeks or longer, 3 months or longer. The goal really is to find something you enjoy doing and keep doing it. I know a lot of people have been doing pickleball lately. I myself, I like to do Pilates. I do a small women's group of Pilates or yoga. Um, you know, it's really important to find something that you enjoy that you can incorporate into your life so that the exercise doesn't really feel like a task anymore, but it becomes a habit and it's something that you enjoy doing, because you're building your strength, you're building your balance, and you're helping all your cognitive reserves stay in place. So evidence has shown that exercise 3 to 5 times weekly will significantly improve your overall cognition and your memory, especially in older adults. So just kind of a clinical summary of what we've been talking about. Um, Exercise improves your cognition by increasing the blood flow to your brain, by helping with new neurons form and that synaptic memory occur. It strengthens your brain's connections all throughout your brain. You think about it as electrical wires all throughout there. Um, it helps improve your executive control networks, and it reduces inflammation and stress. All these things will lead, when you exercise, all these things will lead to a better cognitive performance and a better cognitive state of mind. So, and then we know the clinical gains of exercise, and we've kind of been saying it all along. You have that improved strength, your increased balance, you're able to decrease falls, improve your executive function, improve your processing speed, your working memory, and your global cognition. And you can see, like, exercise can be, again, we all start at different levels. And then when you want to put into the task of like the dual task and the cognitive component of exercise, it could be something as easy as setting up pins across the room and having somebody roll a ball and knock over pin 6, and you call out an order on how to do it, or, you know, bending and placing something down and picking it up and coming back and then having to remember, like, just remember a number, run back over and grab that number, grab a pin. It just, there's different tasks that you can do to work on a dual task performance. And the other clinical gain that's not even mentioned on this side is also that exercise improves your confidence. So it improves your cognition, your confidence, your balance, and your strength. So why outpatient therapy matters for fall prevention? Besides the fact that I'm a therapist and I do this all the time, outpatient therapy, I feel like, is extremely important for fall prevention. We don't always understand exactly what makes someone fall or why someone fell. Again, because it just happened, talking about my mom, she complained of dizziness, complained of pain, and stated that the pain actually started when she fell 30 days ago. So why does she need outpatient therapy? Well, when she fell, she was getting the 30 days ago, she told me she was getting something out from underneath her bed. And so she was down on her knees. She couldn't get up off of her knees from the floor, even trying to hold on to the bed. So that let me know that her legs were much weaker than what she led on anyone to believe, and that maybe going to Vegas at that time may have not been the best idea, or maybe I would have given her a walker or a rollator to take instead of a cane, so she had something to stabilize her more. Or maybe we could have gotten her into outpatient therapy before she went on vacation, so she at least had time to get into an exercise program. So I always recommend anybody who falls, talk to your doctor first. Always go over the reason why you may have fallen and anything that you can report that you think might be relevant. I had to pull things out of my mom, but if you know, or you're helping someone, a loved one out, who had a fall that you witnessed or who told you they fell, you might want to ask questions about what led up to the fall. Were the lights on? Were they dizzy? How did they feel? What time of day was it? You want to meet them at where they're at, but you definitely want to let the doctor know what's happening. And 2 falls in 1 month are a huge red flag for any clinician in the medical field. We get alerted to 1 fall. We're worried after somebody has 1 fall, but 2 in 1 month, that's going to continue on a course of somebody who could be known as a frequent faller and somebody who definitely needs therapy. So I would say if anyone's fallen, again, report what happened to the doctor. And I would always ask the doctor about outpatient therapy, because you can't go wrong if you build up your lower extremity strength, you work on your dynamic balance, then they'll start working on how well you walk and your gait speed, like your walking speed and the quality of it. Like maybe you're walking with your legs too close together and didn't realize it, and they will help retrain you on how to walk standing upright, improve your posture because it works on postural control, walking safely. And then we'll even give some home exercise programs, because exercise programs can reduce your fall risk from 20 to 50%. And all these things will help you maintain your independence and your mobility in the community, which is key, right? It's all about aging in place and helping those you love age in place. So I always recommend that anytime somebody has fallen, report it to your doctor and seek an outpatient therapy evaluation. So if you do go to outpatient therapy, what that will address is the individual fall risk assessment. So we would look at your strength, your balance, how well you walk, and your endurance. We'd also look at your sensory input and your vestibular function. And what I mean by vestibular function is that little inner ear stuff, like when you, I guess, like, say you were reading the paper and then you put your head up, do you get dizzy? Or if you're laying down and then you sit up in the morning, or in the middle of the night to go to the restroom, is there a dizziness occurring when you change your head in the position of your head, or you put your head down to slip your shoes on, and when you come back up, you're like, whoo, does that happen? That's your vestibular system. So we would look at that. And then we look at your overall functional mobility, like how well do you transfer? Can you get on and off the toilet safely? Can you get in and out of a chair safely? How do you have stairs? How well are you walking up and down the stairs? What does your walking look like? Maybe you walk one way in your home and then you walk differently outside because you're on a different surface. We will also look at your functional movement. that sit to stand I talked about when you're getting up and down from a chair. What if you do fall on the floor? Like my mom, she didn't fall on the floor, but she fell getting up off the floor because she couldn't get up off the floor. So that's called like a floor recovery. We teach people safe ways to get off the floor if they do fall. And then your community mobility tasks. Do you go out? Do you drive? Do you take a bus? Do you take mobility? How do you get around? How do you get out of your house? Do you in your home not walk with any assistive device, but when you're outside, you might need a cane or a walker, or in the house, you use a cane, and outside, you might need a walker? All of these are things that your outpatient therapy addresses. And then environmental and behavioral education. We would tell you about home safety strategies. Like I was talking about the exercise earlier, and holding onto the railing if you're doing step-ups, holding onto the chair if you're doing single leg stances, or even just pushing your chair up against a wall if you're going to work on those sit to stands. You know, we can discuss different lighting in your home, different ways to keep you safe. If a visual issue is a reason why you may be tripping or falling, we can even recommend home safety assessments. Sometimes we even come out and do them for you. I've done a number of home safety assessments and made certain just small little modifications that have allowed people to stay in their homes. And we're not talking about full remodels and a whole new walk-in shower. I mean, sometimes for some people, that's what they need, but other people, it can just be simple things. Like putting little rubber feet on the bottom of your chair over your hardwood floor so your chair doesn't slide. It's just a $5 fix. There's many different things that we can do for our home safety strategies. And then we look at assistive device training. Again, that's training with like a walker, a cane, a roll aid, a quad cane, one of the canes with 4 feet. We'd work on all those things. And then energy conservation and pacing. Again, we all come to this at many different levels of function and fitness. So some people might need rest breaks. So we teach you how to pace your day so you can take rest breaks. We teach you exercises and how to incorporate rest breaks within exercises. So outpatient therapy addresses the whole person as a whole, and things to keep you safe and to keep you in the community. The long-term benefits of seeking outpatient therapy is that it can prevent future falls. It reduces that reoccurrent fall risk after the first fall. It improves your confidence and participation. It helps decrease your fear of falling, because again, most people who fall once or twice, unfortunately, like my mom, they're afraid they're going to fall again. And so then they limit themselves and they don't do anything. And I have seen that with my mom over the course of the last year. Didn't realize she just fell, like I said, twice in 30 days. But over the last year, she hasn't really been wanting to go out. She hasn't been wanting to drive as much. She hasn't been wanting to just do certain things that she used to enjoy. And I really truly believe now it's because she was afraid of falling. But now I did get her to open up to me and be more honest about what's going on with her. So we're going to get her the help she needs. So again, when you become part of an outpatient therapy program, it will help you with that confidence. It will help increase your activity levels. It will help reduce your fall risk because you're working on your strength, your balance, and it helps with that cognitive function. And then it supports long-term self-management. Like we'll give you a home exercise program. We recommend, like I said, that community wellness program. If you can find an awesome Tai Chi program or a seated exercise program, or even join a fitness center that has activities that you enjoy. That's always one of our recommendations upon discharge, because we don't want you, once you leave outpatient therapy, to stop moving, because then it's all for naught, right? And it gives you, we'll teach you lifelong fall prevention strategies. I sometimes I think about the body, sometimes like a car, everybody needs a tune-up. So this is just, this is my company. We work for Vital Strong Outpatient Rehab. We are part of the Future Care umbrella family, but we do have outpatient at Vital Strong. I think you guys are PG County, so we do have a facility in Landover, Maryland, and we do accept all different types of insurance, Medicare, Blue Cross, United, TRICARE, most of your PPOs, almost all of your secondary insurances. We do accept insurance. So that's the other great thing about outpatient therapy. It's generally covered by insurance. And because again, your insurance company benefits from you staying strong as well. And then we just need a physician referral. The physician referral can be for falls or to improve strength secondary to a fall, or to work on balance secondary to a fall. We also have a couple of cognitive programs as well. And I think I'm going to be coming back to do one on brain health and wellness and how to keep the brain healthy. So we work on a lot of different areas of cognition, cognitive exercise, and physical exercise. So again, convenient locations. We're all throughout Maryland, and we do have one in Landover, which I guess would be the closest one. And we have flexible scheduling. And there's the website, vitalstrongrehab.com. And that is just the number to call if you would like to schedule a visit or tour one of the outpatient facilities or come and work with us. And I think if you go back, Caesar, to the very first slide as well, I mean, you can leave this up for everyone to see, but and I will say it out loud. I put my email on the very first slide. Should there be any questions about the stuff that I talked about tonight, it's garrisonj@futurecare.com. I should have put it on the slide too. But I'm always willing to answer questions and get some answer questions and help guide you in the right way if I can. And again, I always recommend outpatient therapy. If you've fallen or if you're you don't even have to fall. If your balance is off or you feel weak, ask your doctor for outpatient therapy. Chances are your insurance covers it. You'll get stronger. You'll get back into a routine, and it doesn't have to be mine where I work at. It can be anybody's. Honestly, I'll be honest with you. I recommend that people go to the place closest to their home or the place that has the programs that they're looking for. Like the type of equipment that they want to work on, because some places really just don't have the right stuff to get people better. So always check the place that's closest to home and make sure they have what you're looking for. But thank you for hearing me out, and I would love to take any questions if there's any questions.
Yeah, let me go jump onto the first slide real quick so everybody can get your email.
Sure.
Right, there's your email again. If anyone has any questions, please feel free to reach out to Jessica. And that will conclude tonight's. Thank you again for being here, to everyone that joined tonight and for taking time to learn more about dementia awareness. A huge thanks to Jessica for taking the time to share her knowledge and all her experience. We truly appreciate the work that you do to improve dementia awareness. And I just would like to add that everyone should always remember that together, through education, compassion, and community action, we can create a more informed and supportive environment to impact everyone affected by dementia. And I just want to share a few closing remarks real quick. For anybody interested in improving their tech skills, the Gale program, in partnership with the Senior Planet and MUG, is going to be hosting classes for improving your digital skills in a new generation. So if anyone is interested in joining, please feel free to register down below at the link provided, or feel free to scan the screen with your phone to register. Also, if you missed any previous videos or sessions, don't worry. All past webinars are going to be available on our YouTube channel. Um, we encourage you to subscribe so you never miss any future presentations, and want you to remember that your voice always matters. And we invite you to please complete our short feedback form to let us know about any topics you would like to cover, or any speakers you would like to hear from next, or just any suggestions for future programs.